Hello, welcome to a new episode of the Healing Hour for the month of May. Today we have joining us Dr. Mao Shing as well as Frances Lam, a key practitioner from our Santa Monica clinic, and they are going to be chatting with you about advancements in integrative cancer care. I want to share with you that they have also just finished up writing a book on this topic that will be launching very soon for us. So we're going to be chatting about techniques with you and the advancements in care, but we will also be talking about their upcoming book because it's chock full of tips, whether you are currently going through cancer treatment or whether you are looking for practical ways in which to arm yourself with preventative medicine. So what I'd like to share with you on this particular topic is that in the face of cancer diagnosis, most individuals will immediately assess how to root out the disease with conventional cancer treatments. Many experts now suggest that it's time to take a more holistic, long-term approach to this, so that there's closer attention paid to the overall health of the individual. The emerging field of integrative cancer management is a patient-centered system of comprehensive care that uses lifestyle modifications, acupuncture, mind-body practices, and natural products. This rapidly expanding field of care fuses the best of conventional and alternative treatments. So as I mentioned, you have Dr. Mao and Frances Lam joining us today, and they're going to explain the latest developments in integrative programs that strive to battle cancer while also nurturing the patient. We also have joining us tonight Phyllis Koenig, who will be joining us a little bit later, and she's a very cherished patient of ours at the Tao of Wellness clinic, and she's going to be sharing her cancer journey with you. So we're very pleased to have you tune in with us today and learn all about complementary care and its ability to ultimately improve the quantity and quality of your lifestyle. So let us get started. Welcome, Dr. Mao. Welcome, Frances. I think let's start off first with Frances. And if you can share with us, Frances, why do you feel that tonight's topic is important for us to discuss at this time?
Well, right now we are seeing an increase in the demand for complementary treatments. And I'd like to start in 1999, Memorial Sloan Kettering, which is a major cancer institution in New York, opened a integrative clinic or combined their integrative clinic with their conventional care. That was 20 years ago. So here we are 20 years later, and now you can almost think in the last 5 years, the interest, the demand has really increased exponentially. So being able to have the tools to use for whether it's the different symptom management, there's the psycho-emotional aspect also, and just your overall wellness is incredibly important now. Another really good example, just almost 2 years ago, going on 2 years in September, St. John's Providence here in Santa Monica,
yes,
are there doing, helping them with their Qigong for cancer support, their family members, friends, and survivors. So we are seeing this trend. So I think it's a really important topic right now to bring it out, to discuss more, have those conversations, so that people will have access and really understand that these complementary treatments are evidence-based. And that's why a lot of the hospitals, a lot of the conventional treatments are combined because it is evidence-based.
Okay, thank you so much, Frances. I have to interrupt both of you for a moment because Leah is giving me a heads up that while I can see both of you and you can see me, for some reason anybody who's on Zoom on video can see you all, but those on Facebook cannot see you at this time. So something is not right about our video screen.
That's interesting, because
They can hear us?
I mean, it's we log into Zoom exactly the way we're supposed to do it, and it's
Right. No, I know you did. I don't.
And log back in again.
I don't. I don't know what to say. As I said, I can see you both, so I'm not sure what the connection is. It's connected to Facebook, so it's not about it not being connected to Facebook. It's something else. What about if do you have a computer in there? Maybe if we have a computer connect to Zoom so that it is, it's just turned on to the link, but not necessarily that it is speaking. Oh, okay. You know what she's saying? Okay, she's saying that she does see you now, so there must be a time delay is what they're experiencing.
Okay. All right, that's fine. We'll have it back up. It's okay.
Okay, so time delay, and we need you to speak much louder. There's still an audio issue is what she's saying.
All right, we will do that.
Okay, so let's jump back into this. Dr. Mao, I want to ask you, what motivated you both to write the book, Live Long, Live Strong? And
well, yeah. So
no,
my
no,
book is,
I really want to know about the main message that you'd like for readers to have from this.
well,
And speak much louder.
The inspirations from our patients, right? I've been working in this field for almost 35 years. And I would say the first time I saw a cancer patient was when I was doing a post-grad residency in Shanghai at the Shanghai Medical University and its attached hospital. And it was a tumor hospital, cancer hospital. It was 400 beds.
Mm-hmm.
I did a 3 months rotation there. And every single day I saw patients receiving chemotherapy, but at the same time drinking their herbal tea and getting acupuncture treatment, going outside doing Qigong therapy. These patients, they're sick for sure. They have a condition that's so scary, but they look happy and they look like they were doing well. And so after I came back from that experience and joined my father and both my brother and I took over his practice, I began to see many cancer patients. And these patients were coming to me initially for side effect management. But more and more over the years now, they're looking for ways to, hey, what can I do to enhance my recovery, increase my longevity, my quality of life, and all of these objectives. And so this is 35 years really in the making, this particular book, and really, truly inspired by our patients we've seen over the years who came in with stage 2, 3, 4, and cancer, and were able to experience the benefit from what we have to do in terms of collaborating, bringing the best of East and West together. So my message really, if you ask what message we have, the message really is, when you are staring in the headlights, don't feel like you're a deer. All right, so don't do that.
Right.
Instead, what you do is use that light to illuminate the paths that have been created, that have been discovered, in front of you, which is Chinese medicine. Have been taking care of patients, cancer patients, for thousands of years. And now with this beautiful integration and collaboration with Western medicine, we are able to help you so much more. And so, don't give up, even when when the prognosis or the news is dire. There's always a way. And so we want to give patients information so they can make informed decisions and choices. And this is not about don't do Western medicine. It's about what else can you incorporate into your conventional oncology program.
Mm-hmm.
And later on today, we're going to have Phyllis come on the show and talk about her experience in this collaborative process. And I think she could articulate that probably much better than we can, because she's the one that went through it. We just provided the care. So
I know, and I'm so excited for her to come on. I mean, I am excited about this book too, because I've been fortunate to read excerpts from it. And as I was telling everyone earlier, this is such an exceptional piece of work from you both, because it really is, as you say, something that is a lifestyle manual, not only for the cancer management, but for those of us that are looking for preventative ways and just thinking about our longevity as individuals. And I don't know about everybody else, but I'm planning on sticking around to about 125. So I want every tool within my access to live the best quality of life that I can.
So you actually brought up something very interesting, because we hit this topic right up the front, right? We named this book Live Long, Live Strong. Of course, that is what we wish for everyone, especially cancer patients, people with this diagnosis. But furthermore, aging is the biggest cause of cancer. Aging. So the fact of the matter is, as we get older, our risk for developing this disease goes up. And so what can we do to reduce our risk? That is, don't age, right? And
right.
As everybody knows, I mean, I wrote a book called Secrets of Longevity, having interviewed hundreds of centenarians around the world. How do these centenarians live to be 100 without developing the typical modern disease of heart disease, diabetes, and cancer that kills a lot of people? And so it's because they have learned or stumbled upon, a way of life, a lifestyle that allow them to lower their risk drastically for developing disease of all kinds, especially cancer.
Right. Well, let us delve into this more. Frances, I have a question for you. How would you describe the opportunity to practice what you're teaching in your writings of this book?
Well, it's an absolutely wonderful opportunity to...
And I need you to speak really loud, because everybody is so, the distance of it, it's the Facebook people that are having the challenge to hear.
It's an absolutely wonderful opportunity to be able to broaden, making sure that the general public, whether you are a cancer survivor, a patient, a caregiver, family member, healthcare practitioner, oncologist, anyone who is trying to find a way to enhance the treatment, your cancer, complement it. Here is a book, here is a resource where you don't have to go on your own and delve through pages and pages of different websites. It's all encompassing. And so I think that is really the benefit of this book, is that the information is here. I just want to read a definition. This is from an MD who's involved with the Society of Integrative Oncology. And this is his definition of integrative oncology. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes the mind and body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants. So I have to say that really actually summarizes, I feel, the purpose of our book alongside what Dr. Mao has been saying. So, yeah, we really do want to emphasize it's a combination, and with an increase in survivorship, because conventional cancer care has been enhanced over the years too. So we're seeing an increase in survivorship versus fatal disease. So now we need to find ways of survivorship. How do we increase longevity?
Right. And what I love is that everything is in partnership together. So literally through what you all are doing alongside the conventional medicine, everybody's working hand in hand to support individuals in every aspect of their lifestyle and let them know you're not alone in this. You have this wonderful system around you that is going to do everything they can on a mental level, emotional level, on a physical level, and on a spiritual level to keep you going and moving forward in the direction of healing yourself at the root of it, truly, from the heart out.
Exactly.
Okay, next question. Dr. Mao, walk us through what your approach is in treating cancer. So based on these things that Frances just shared with us, and of course your extensive work in this, how do you walk hand in hand with the patient?
Well, so typically a patient comes in with a diagnosis, whether it's breast, colon, ovarian, lung, whatever cancer might be. And, you know, the first thing we have to do is listen. We have to listen very carefully. We take our time because this is when patients are telling their story and their fears and all the emotions that will come up during this first session. And so we recognize the importance of mind-body, the connection between the two. And we want to make sure that we address the emotional, the spiritual, as well as the physical. So we listen and we ask lots of questions and we try to understand the big picture: family history, genetic history, lifestyle habits, traumas, infections. I mean, there's many causes of cancer, and yet so many people go to oncologists, they get diagnosed, and they ask the question, why? What caused my cancer?
Right.
We don't really know. Well, if you have breast cancer, you know, 85% of breast cancer in North America are attributable to estrogen. Having ER positive cancer, estrogen receptor positive, means that, hey, let's look at how much pesticides and formaldehyde and plastics you have been in contact with consuming all these years. And think about this, you know, how many women eat their lipstick?
Oh my gosh, I just felt like this
there's
light
so
bulb
much
went off in
plastic
my
and
head.
toxins in that thing, and you're just eating it every single day. You can tell me all you want, like, I don't use plastic.
Right.
You've been eating plastic. Yes, you don't suck from a baby bottle. It's got BPA, which they finally removed, but yeah, but you've been eating it. But what I'm saying is that what we try to do is understand, because it's very important for patients to know, like, why? Why did this happen to me? Because only by understanding why, and maybe we don't have all the answers, but we have a pretty good idea of what happened, right? The stress, the trauma, that lower your immune function. You got a little mutation somewhere along the way. Look, mutations happening all the time to our cells. You get infected, you get virus, you get trauma, mutation to the cell. The DNA gets damaged, and that cell is replicated over and over. And now you got a team, a group of bad cells that can turn cancerous. So we just need to understand that once we get understanding that, now we talk about options. Okay, you're doing chemo, you're doing radiation, surgery to remove the lump. But these are all symptomatic treatment. It's just getting rid of your condition and symptoms right now. But what are you doing to make sure you're getting at the root of it and that you're preventing it from coming back?
Right.
So these are just as important. So we look at lifestyle, we counsel on nutrition. There's different type of nutrition when you're doing chemo versus after you're done with all your treatments. How do you prevent it from coming back? What is the best preventative nutrition to lower your risk across the board, as an example, right? So nutrition, herbs. There are lots of research on herbs. There are over 100 herbs that we use commonly that have positive benefits for the immune system, as well as helping to discourage cancer cells, right? So, you know, we don't go out and tell people, hey, we can cure cancer, because we don't cure cancer. What we do is we empower and equip your body, which is very powerful, to fight the cancer. Your body can fight it. We need to make your body do what it's supposed to do and what it knows how to do. So with herbs, acupuncture, we use that to troubleshoot and relieve a lot of the symptoms. You know, one of the most common problems we see is during cancer treatment, conventional cancer treatment, is nausea, vomiting, low energy, depression, and neuropathy. Or I mean, these chemo agents can knock out your nerves endings and create numbness, tingling, and all kinds of problems. And estrogen blocking, if you get breast cancer, muscle pain, joint pain. I mean, the beautiful benefits of estrogen is that it lubes your joints, and when you don't have it anymore, you got fun. Not to mention the hot flash sweats and weight gain. I mean, there's a lot of issues, so we try to help patients. Hey, look, simply because you have cancer doesn't mean you have to suffer.
Exactly.
I mean, we can help you. So, and we work with them emotionally. We teach them how to meditate. We empower them to use disease as a impetus for change, for positive change. You know, I sometimes tell patients this, and it's hard for me to say this sometimes because, you know, when you get diagnosed with cancer, the last thing you want to hear is, by the way, you know, it might be a blessing in disguise. And they look at me and they go, are you nuts?
What are you saying? Exactly.
I don't wish for anyone to have cancer, but you know what? I tell you something about cancer. Cancer is empowering because you have it, it's like nothing else matters anymore. Like all the trivial stuff you used to worry about melted away. It released. You said, you know what? I gotta live. I gotta do everything. I'm willing to change. I'm ready to change. But before cancer, there were many opportunities, and they know what they need to do to change. Whether it's bad relationship, whether it's a boss that's making you sick, whether it's, you know, I mean, all these things that happen in our lives we don't do anything about. Once you get cancer, it's powerful. You go, heck, it's my life. I need to change because I want to live. So I use this as an opportunity. I said, look, this is a powerful opportunity. And by the way, that opportunity only lasts 1 year. You know why? Because once you get better, everybody, so look, while you're in the middle of cancer treatment, everyone around you is willing to change. If you tell them, I don't like this, I need this change, they're willing. But once you get better and you're well, nobody is motivated to change anymore. Everybody goes back to their old ways. So you only have a window of opportunity. And so it's pretty interesting.
It is very interesting, and I'm going to bring up later that actually is one of the questions that was submitted to us, is how to deal with that post phase where people are very empathetic and open to change and open to be supportive, but then the moment that they feel that you're not in jeopardy any longer, they assume, oh, that individual's better and doesn't need support any longer, and it is an emotional struggle within of how to still say, no, I need my support system around me. But we'll return to that later. I think it'd be really nice for everybody to first hear the impressions that Phyllis has, and then we'll go back to that individual's question. I have a question for you, Frances. You know, we were talking about part of this topic today is about recent developments that are taking place in this field. Can you share a little bit more? Dr. Mao was just sharing some things with us. Can you tell us what other recent developments are taking place right now in this field for us? Oh.
I mean, since Phyllis is here, why don't
you
we
want to
just
have
invite her join us, and so we can have the conversation, you know, later together.
Oh, fantastic. Yeah, she's there.
Yes,
I will say right now, I'm just going to say again, please, I need everybody to speak really loud because those on Facebook are having a challenge to hear you. So if I keep looking to the side, it's because Leah's texting me saying, tell them to speak louder.
Yes, of course, of course. Phyllis, come join us.
Hello.
Hey.
Hi.
Yeah. Yes.
Hi.
All right, please have a seat. So
Yeah.
go ahead and
Hi.
answer your question.
Oh, hello, Phyllis. Welcome. Thank you so much for taking time today to come over and join us.
Oh, please, it's my pleasure. As
So-
it's a pleasure. I'm alive.
Yes, you are. Yes, you are. And you know, one of the things, you and I haven't met personally, but one of the things I hear about you so often, and I've said it to you as we were preparing for tonight's chat, that It's very beautiful because you are so empowering. You're a very strong woman to begin with. And of course, you lead a very active lifestyle, but then through your journey of this process, you have developed even more strength. And I really want people to hear about your journey today, what you experienced, and what you feel has impacted you the most and changed within for you throughout this process.
Yeah, well, it's a lot of questions, so I'll start with, what was the first one?
Tell us about your journey. Let's just start simple. We'll start simple. Tell us about your journey.
For a while.
I had stupid brain, but no, my brain's all back together and back into elephant memory. But do say, what was the first question?
So tell us when you first found out that you have had cancer.
Yeah.
Tell us about that and walk us through your journey.
Yeah. My story is actually really stupid. So I'm just gonna say to all of your listeners that are hearing me, and thank you for what you said, by the way. I am all of those things and proud of it, and I don't feel the need for false modesty. And
No.
like, oh, I'm just the little mouse sitting over here. No, I'm very fun, very empowered, very all of it, and I'm alive and grateful and all of that too. But so my story started out with negligence, out and out pure negligence. My mother's side of the family had all sorts of cancers, but in my head, because I thought it skipped my mother, I thought, I am fine. Oh yeah, your brother died of cancer. Oh yeah, your sister died. Oh yeah, my first cousin, your niece died. None of that clicked with me. So when I was first diagnosed, I had a lump, a very big lump. I had a 4-centimeter lump in my left breast. And I kept thinking, it's nothing. It's moving around. I'm just very cysty. It's not a big deal. And, just keep moving forward. Just don't stop for anything. And then one day I went in and was, I went through this is how it works. You go to the doctor and you have a mammogram and they say, hey, do you mind waiting for just a minute? Do you mind sitting outside just waiting? And you sit in a lonely chair in the doctor's office watching everybody walk by. They come out about another 20 minutes later, the mean old, many doctors, and they say, do you mind if we take a little bit of tissue from you? We just want to see, we see something, it's probably nothing. Do you mind waiting? And then you wait another 15, 20 minutes all alone. And all the while I was thinking, okay, this is fine. I'm just cysty. Eventually, 3 or 4 days later, I left the office of the doctor. The doctor said, okay, have a great Thanksgiving and be prepared to have cancer. And I left thinking, after a few words with him, after I said, just give me a basic idea of what that looks like. How would I get myself prepared to have cancer? I never had a question answered. I left with my arm up in a sling from the biopsy. And on Monday morning at 9 o'clock in the morning, the phone rang and they said, you need to get down here quickly. You're very, very, very sick. So that was the beginning of the journey. And the beginning of the journey was, I went from being the strongest, most confident woman with a very successful company, knowing thousands of people. I always say I can count my friends on my hand, but I know tens of thousands of people. And I went from feeling like a powerhouse to the mouse. And I was hysterical for, I don't know, 3 or 4 weeks, a year, a long time. I was a hysterical mess. And I couldn't get my act together to figure out what to do. And then the journey began. Started with Western medicine and several different places. There's schools in Los Angeles. One lives on the west side, one lives on the east side. I was lucky enough to find Dr. Christy Funk.
Oh, yes.
Yeah, 2 feet tall, having triplets. And she said, I can't help you, but I will tell you one thing. I'm going to send you to another doctor. But before you do anything, you need to wrap your head around Chinese medicine. You have to wrap your head around a doctor of Chinese medicine. You need to go see Dr. Mao. You need to go to the Tao of Wellness. And she kept feeding it into me in a very real, you know, beautiful, friendly, but very serious way. And it started, my husband drove me down, and I flew into Dr. Mao's arms, screaming and crying every time I looked at him. And it was the beginning of just, you know, the healing process. Because I chose to do a combination of Western, also with his guidance. I mean, there was no alone journey. It's interesting because I was hearing you talk about what happens when it's all over, you know, and I was sitting on the side thinking, it's sort of like a death of something. You know, death isn't always the most horrible thing in the world. When you read tarot cards and you pull anything spiritual, you pull it down from wherever you pull it from.
Right.
A death of something could be a door to something else. And so the death of the end of the cancer can also be a wide open door to the next part of your life. So it may be a death and it may be horrible, but it's wonderful because you've gotten your life back. Regardless of, I mean, my staging was stage 4 metastatic, pack your bags, breast cancer. You know, I had 3 months to live, according to them, until I found Dr. Mao and Tao of Wellness. And so, you know, my journey was unusual. I'm having my 11th anniversary, and even my other doctor said, you are so wild. And they're not supposed to say this. We never expected you to live past a year. So the fact that you've made it past 10 years, we don't know what to do with you. I'm asking if I can be de-staged. Can you unstage me? But they don't do it that way. I want to be unstaged so badly, and now I have now there's a joy in being staged with stage 4 because I can talk about it freely. And I mean, it's been a long time. It's been 7 or 8 years since I've been able to speak freely.
Right. I thank you. I mean, you've shared so openly and authentically, and I think it's very inspiring for others to hear. I know for me, my sister-in-law has been through cancer. I have other family members that have been, and there's a common thread within all of you of, it's been described to me before, it's like ripping off a Band-Aid, and you feel like you go to the deepest depths, but then you come out the other side, exactly how you said, as if it's the death of that, but you come out so much more aware, and a door is flowing open for how you want to live your life.
And also people that you don't even know just come falling out of the sky. Like literally my husband and I, and I'm not religious at all. I have a very spiritual side, but I don't have any connection to my birth religion, except I like the holidays and the fun stuff, but I don't connect on that level to this creature called God or whatever it means. It doesn't live inside me the same way. But I will say, for the first time in my life, my mother, who was a big believer in angels, I used to see them like the duck in Groucho Marx. The angel would just flop down from the sky, and we would leave together, my husband and I, from wherever we were, and just look at each other. And he's not a very emotional creature. He's like overtly emotional. We just look at each other and say, we just met another angel. I could see the wings back there. So, you know, that was something new for me that I learned. There's so much new that came out of it. So much new.
What's your favorite experience? When you talk about this newness, what do you think is your favorite experience?
Well, I do mean it, and I want to say it here. My favorite experience is this guy right over here. This one made me cry and laugh all at the same time. So I would zoom down here 3 days a week, sometimes 4 days a week, in between the chemotherapy, because I had 17 rounds of chemotherapy, then surgery, then radiation for 30 days in a row. But every week, religiously, I would come 3 or 4 days a week, and he would walk in and I would burst into tears. And then within 4 minutes, we were laughing about something. he has a magical way of like doing shadow puppets while I was crying my way through the first few minutes.
Mao, you have a hidden talent we don't know about.
Oh, so good. It's so crazy. I just went through it again with Bell's palsy. My whole face collapsed.
Right.
And I flew back from Australia screaming again, my face is falling. And we went through 3 months of healing. And instead of being paralyzed for the rest of my life, you couldn't hear a little lisp, but I mean, I think I look reasonably normal. So my number one favorite thing was coming here. Truly, I mean, everybody needs to know that, because a lot of people say to me, I posted today on my own feed, and I had a lot of people not saying, oh, that's great, we can't wait to see you. I had a lot of people saying, I went to Dr. Mao too, and he blah, 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 did this for me, or my cousin went, my sister went. So that newness to me, that open world, was probably number one, because if it hadn't been for Dr. Funk, I would have gone to some classic Western doctor, because my father was a doctor dentist. I would have drawn from that memory, and I wouldn't have known. You know how you don't even know what you don't know you don't know?
Yes.
Okay, so
and you still don't know.
and you still don't know what you think you do. But that was number one open experience. And then I think also all the people that I met along the way. I have a dear friend that I met here who's become a lifelong friend of mine, who I just relate so deeply to. I relate to her and her family, and we've just become so close. And she was a mess, and I met her through her mother. Her mother was this wonderful psychic who lives in Ojai. I guess everybody who lives in Ojai is psychic, but I met her. And
they're in a vortex, haven't you heard?
Vortex, and she led me to sitting in front of Stevie Wonder and Lady Gaga, because she works at CBS and she's an event planner, and all this stuff just happened. Like, I want to hear Stevie Wonder sing to me one day, clunk, right in front of my face. So the world opened, and that's incredibly superficial that I just said that, but it's very real.
Right. So I don't think that's superficial in the least. I feel that life is a game, and that when we open ourselves to abundance can come in so many different ways to us. So you had a desire, and the universe answered your desire.
It's so true. It's so true. I have it. My daughter is a wellness person in the Santa Monica community, and so it got even, she latched onto that in an even stronger way when I got sick, and she thought she was going to lose me, as well as her husband's father was dying at the time of I can't remember the kind of cancer. I'm sorry, I probably shouldn't say it anyway, but so I lived and he didn't, and that was a big turnover for me in life, a big turnover for her. So she's been in the wellness community also, not to the same degree as Dr. Mao. Obviously, you can't mess with 90 generations of Chinese.
38.
Let's not age him.
1,300 years.
1,300 years, yeah. My daughter's only 34. So 1,334, it's close. So I'm with you on the abundance. You have to, I think when you open yourself up to everything new, it just shows up. You show up for it, and it shows up for you.
Very much so. Let's talk about, since I have all of you together, let's just talk about, if you don't mind, Phyllis, a little more about the treatment, and maybe Mao, you can share some insights, because again, this was very customized for you. And I think that's a difference between Western medicine and Eastern medicine, is that the Eastern approach is very individualized.
I'd like to just make sure that it's clear that I'm one of his estrogen positive patients. So
Which means?
I come from a very Eastern European Jewish family on both sides of my family, so I was instantly tagged with, you must have the HER2 gene, and you must have the BRCA gene. Well, I didn't have any of those things. I am estrogen positive, so my estrogen receptors were being attacked by these, you know, when a cancer cell has a life, a morning, noon, and night, and that cell needs to die every day. And then every time you take a breath, these are cells, you're building cells, you're creating new life. So when your cells don't make that day, they split, divide, split, divide, split, divide. That's, you know, that you've seen that image a million times.
Yes.
So mine are estrogen positive, and they attacked the cancer cells that lit my body up were because my estrogen. How do I tell this? No.
Yeah, in other words, your cancer cells were driven by too much estrogen in your body.
Yes.
And that most of that estrogen is either from the outside of the body, they're called xenoestrogens, and those are the pesticides and the formaldehyde, the plastic. Lipstick, exactly. and or internally, they were coming from your adrenal gland where you're stressed. Every time you get stressed, you produce more adrenal estrogen. So you were just like fueling the cancer cells. Yes.
To say nothing of the fact that I led a life of working. I worked on a farm when I was 11 years old, and my job was to take slugs out of ground cover. So there must have been so much pesticide on there.
Yes.
I worked in a dark room for 5 years for a journalist, and my hands were in chemicals all the time. I worked for a director who had fog on his sets all the time, thinking, these shenanigans, this stuff cannot be good for breathing. So in terms of like all the things that I've eaten that have gone into my body, hair coloring and lipstick and, you know, all of that, it must have really, I must be bionic level to have even made it this far, but I was bionic by the time I got here, and then he, you know, helped me reduce, get rid of all of that.
Human level.
I'm human again.
There you go.
So that's my side of it. So I just wanted to make sure you knew that part.
No, thank you for sharing that. And I think, again, it's so important, individuals that are listening in right now, for them to see your perspective on this, because now you just pointed out to everyone again, all these little lifestyle factors that we most likely don't even consider until the point something goes wrong within us. And we reflect back, and it's like that aha moment of, oh, wow, well, I did this and I did this, and it being triggered that, yes, there is a history to it. It just takes examining what that is, and hopefully not
cumulative too. I think it's cumulative.
Yeah, no, it's all cumulative.
Yeah.
If you think about it. Yeah.
So Mal, what would you like to jump in and share about this?
Well, you know, I think, you know, my experience with Phyllis was very unique. You know, first and foremost, you know, she's, as you can see, right, she's
dynamo.
Strong, opinionated, very strong, you know, but I found incredible humility that she was so open to my suggestions, you know. I mean, look, I get questioned with some of my, you know, sort of advice, no question. My wife questions me every day on everything I say, but I think that's the job of a spouse. But no, so with Phyllis, I found this an incredible working relationship where we talk about, you know, sort of the need for stress reduction, meditation. You took to it very quickly, very easily. You know, nutrition. You know, and it helped that your daughter was into nutrition. So
no, but instantly he gave me a list like this. It was like.
She didn't like
we got, my husband and I got together, and I fixated on making sure I ate nothing but, and I remember saying, we can't eat here. There's nothing on the list that I can have. We have to go shopping right now. And I was militant about it. No, I was so happy. That was the best thing that ever happened. Well,
and but that's the thing, though, right? I think about if it was another patient in your shoe, whether they would have had the chutzpah or gumption to really, and the discipline and the stubbornness to say, you know what, I'm going to do 100% all the way.
All of it.
whatever it is that it's going to take for me to triumph over this condition. And I have to say, I mean, the odds were against you statistically. I mean, stage 4 breast cancer. I mean, when it's gotten out, the survival rate is very, very low.
Very low. And I even had a Western treatment that they stopped administering to stage 4 patients because they say, what's the point? I mean, you're going to die anyway, so why would we give you Abraxane? They took it off the market after I was treated. And when I asked my Western doctor, Dr. McAndrew, Philomena McAndrew from Cedars, she choked out, well, there's other drugs out there, and I'm very persistent. And I kept saying, no, I need to know the answer. I need to know the answer. Why did you give me the wrong drug? No, that was perfect. Okay, so where is it? Oh, it's off the market. Well, how come?
That's Phyllis for you. I mean, she doesn't take no for an answer.
No.
And I think that's part of what it takes in some way.
Yeah.
This is the hardest thing that you've ever done.
Yes, for sure.
Right.
Absolutely.
And but I think the combination of who you are, plus the help that you were able to get.
Yes.
The team is so important. I mean, I can't overemphasize that. Getting the right people. I mean, you do these huge productions, commercials and so forth. You don't have the right team. The thing doesn't. That's right. Falls apart. And so I think but you went into that producer mode a little bit. Okay, I got to get all my people together.
Well, you were producing your own life.
Yeah.
That's your life you were producing. So, of course, you're going to produce it with the best team.
I owned my own company at the time. I had just started my own company. I'd gone to Vietnam for a month, came back after 20 years of being in the business, had started a company, and 8 months later I was diagnosed with, a year and 8 months diagnosed with stage 4 cancer. And I thought, well, I've been producing my whole life now. I'm an executive producer, owner of a company. Get on it. Make this thing happen. So yes, very team oriented and very collaborative and open.
Yeah, no,
but only open to him, not open to everybody. Funny people I would have shut out.
not true. No, I mean you know where to get the wisdom, and I think that's it. Ultimately we all work in teams. We collaborate with the best oncologists, the surgeon, the radiation oncologist. The nutrition, everything that we did as a team. And what was really nice for me was that the Western side, they were so open-minded. They were like, let's do it. We throw this at her, you do your part, and let's do it together.
But Dr. Mao, you should know this. Dr. Mao was persisting at Cedars, and in fact, I'll just say it. When I had my surgery, and my team of my family, my friends, my best friend flew in from New York. She brought her 2 little children. They were 5 and 7. My daughter and all of her friends, and Dr. Mao in nose glasses snuck into.
Yeah, sure.
Into the hospital, because I kept saying, when I opened my eyes from this surgery, do you think you could be standing there? And he had to cloak himself in order to get in with a bag that was like, hey, just coming in with my backpack. But in there were all my stress, with my acupuncture protocol. And he snuck into the hospital to make sure that my stress level was more important, was higher than my morphine level.
I love it.
It was really clever.
Very clever tactics going on.
Yeah. Killed it.
No, well, actually, because it was too short of a time for me to get through the bureaucracy. I can get privileges to come in for the patient, so forth, but it would have taken 2 months.
Yeah, it would have taken all that permission.
And
so it's just like I'll put the hat on.
I've done this a number of times, so it's fine.
But really, what I was going to say about that also is there was an openness, and he was persisting hard to make that relationship with Cedar's work, and there were some very open-minded people there. And I think now again, am I correct to say that?
Oh, absolutely.
So they're very open to that, which again is one of the reasons I chose to stay on the east side of town, because I understood that they were open to Eastern medicine. And that had I come to Santa Monica, where I had a slew of friends who had, like, one of my friends, his father is the chief of surgery at St. John's, and we'll set you up and we'll get you the right room. And I remember thinking, I don't want any of that. I just want to live.
Right.
I don't care about the extremities of, like, I don't care how pretty my room is, because I'm not going to see it. It doesn't matter. It's all superficial. I just want to get well. So where's the best place? What's the best protocol to get well? And which part do I need to, you know, for lack of sounding like everybody else, which part do I need to own? What's my part in this process? And that was a huge growing, you know, a huge growth for me, because I'm so used to telling people what to do and giving advice, and for the first time in a long time, I had to be really quiet and listen and focus, and then do what I was told to do in order to promote the wellness portion of getting well.
So that actually brings up another point that's really interesting. And I'm sorry, I'm just looking at the time because I'm conscious of, I know people have questions they want to ask to all of you, and I want to give them that opportunity too. But my last question for you, Phyllis, before we transition over to that other, does everybody mind to stay on just a little bit longer? I know we're on the hour. Are you all okay to stay maybe another 10 minutes?
Oh, we're good. Are you getting any, like, you getting some?
Yeah, no, we do. I have two screens going, and I've got people who, if you all can just hold your questions. Actually, for those of you on Facebook and on Zoom, you have a comment chat box. So if you can start writing your questions into the chat box. Those of you that are on Facebook, Leah will feed them over to me. Those of you that are on Zoom, you can write your questions into the chat box, and I am able to see those and I'll address them. The only people who will not be able to ask questions are those of you who called in via phone. We don't have a capability for that. But for those of you who may have follow-up questions upon hearing this, if you called in, you're always welcome to email your questions to me directly, marketing@infinity.com. And then I will pass those over to either Frances or Dr. Mao, and we'll get some responses for you. Now, going back to you, Phyllis, you just brought up a really important point, and I think that your journey is so impactful, and you have a very strong personality to be able to distinguish what was necessary for you. Can you kind of, I don't want to minimize it, but can we somehow wrap this up for people? Because communication is one of the things so many people have fear about. And of course, that ends up manifesting into illness within themselves too. You just brought up that you had to make a point of what you needed to do and own for yourself, and then what you needed from that collaborative support team of the doctors, of your friends, of your family. What advice could you give to other individuals that maybe currently are going through cancer treatment, or even those that are just trying to learn a better way of life and communicating their needs?
Yes, I know I can do that actually very quickly, because I have a lot of people who call me. They hear cancer, they phone me. Cancer me, cancer me. So I think that the best advice that I could give anybody would be to say that everybody's journey is their own. There's no magic button. One of my best friends in the world called me because she found out she had lung cancer, and she wanted to know the secret. Should she drink Dr. Mao's teas, or should she drink my daughter's potions? Like, what do I do that's going to heal me? And in a very gentle way, I sat down with her for 45 minutes, and I kept trying to answer in such a way that I could get through to her and say, this is your story to tell. This is your own personal story. And the most important thing that you need to do is you need to open the doors and put up the walls. Put the walls up to all the nonsense that you're going to hear from people, because you're going to get the craziest things that people tell you. They're going to scare you. People don't know what to do, because they're frightened for themselves when they hear that you're sick. So in order for them to feel better, they'll say things like, oh, well, I sure hope, you don't go down like good old Scotty Betty, you know, or whoever it happens to be.
Mm-hmm.
And as the cancer patient, I was thinking, why would you say that to me? So I quickly learned how to block out any negativity. And this is the heart of it. Block out all negativity and stay positive. And I know that sounds like Mickey Mouse, but it really is true. I read nothing but happiness books. I read all of Dr. Mao's books. I watched funny movies. I went the Groucho Marx route. Nothing negative. Don't let anybody in. And when they say things like that, you have to stop people right away and say, I'm sure that worked for you, and I know you're scared, but this is not a conversation I can have with you, because I'm busy trying to protect myself, and I need to surround myself. I need to put a white bubble around my creature, and I need to protect myself. And I love you for all these questions, and I mean it. And maybe I don't love you, but I like you, whatever it was. I like you a lot, but I need to cut you out of my life right now, because the only thing I can do right now is heal. And in order to heal, I need to be very focused on that. And all of these negative questions about your Aunt Susie and your cousin so-and-so and all your dead relatives, it's not helping me right now. It's scaring me. So that advice I gave to my girlfriend, who's the friend that I met through Mao, and she heard it loud and clear. And I've heard her tell other people. I hear a lot of people tell other people the things that I say, and it makes me proud and really happy that I can pass on something that will change somebody's life.
Oh, absolutely. You're playing it forward. And that's the beauty of energetic bonds between everyone. You know, we're here to collaborate together in this lifetime, and to not only be a teacher, but to learn from other teachers. And so you're playing both roles at the same time.
I could spy the other teachers every time. I knew exactly who was safe to be around, and I knew exactly who I just had to be like a lobster and just kind of back quietly out of the room, and then run quickly from that energy, because I didn't want to be splashed by anybody's negative energy.
Thank you.
That's a crucial message for people. Protect yourself in a way that's not mean-spirited. It's just it's a self-care of sorts that's crucial to your healing.
Yes.
If that makes sense.
For me, it does. I hope for all of you that are listening in, it does as well. Please start sending in your questions. We will be ready to answer them. Thank you so much, Phyllis. I'm going to give just Frances an opportunity to share her last thoughts, and Dr. Mao to share, and that way it gives everyone an opportunity to start writing in their questions. I am so appreciative to you, Phyllis. Thank you. I have a feeling everybody's just kind of awestruck here, because you had so much amazing content to share with us.
Oh, well, thank you. I appreciate that. And I hope so too. I don't know about the awestruck part, but I hope that everybody's gotten a little bit of love and
oh, I specifically see words of awe in comment sections. So, so yes, they're awestruck.
Thank you. It means a lot to me. It really makes me feel really good. Thank you.
Okay, Frances, let's start with you. What would you like to share with us? I think we broke off right at the point where I was going to ask you about what advancements you're seeing. So please, if there's anything you want to add in about advancements that you are seeing in care and just your personal thoughts. I know, Frances, you are exceptional when it comes to nutrition, so you might have some tips as well that you would like to share in that area.
Thank you so much. I will, but I do actually want to address exactly what Phyllis said about protecting yourself from the negative energy. And that's how with meditation and Qigong and Tai Chi, it's so important to have that ability to protect yourself from the negative energy from people, because there's a lot of toxic, we say vampires, but toxic energy from people, things, whether it's also from the media. So you do need to stay away from that.
Oh, I entirely agree with that. I have an expression, it's called bubble up, buttercup, and every day just bubble yourself up.
Yeah, bubble up, but I'm going to use that. Permission to heal?
Well, I like my bubbles pink, so I've got a nice, beautiful pink bubble that goes around me every single day when I wake up. And I'm a buttercup at heart, so there you go.
There you go. Fantastic.
So more trend action, I do have to say, and again, going back to studies, and I like to quote studies because it is evidence-based, but here is a study, and I think I find this very interesting. The growth of integrative medicine at leading cancer centers between 2009 and 2016. And what they found was that two modalities, acupuncture being one of them, were most used, acupuncture and meditation at these cancer centers. There was a 89% most people use that, followed by yoga, massage, and music therapy. So increases in the acceptance of acupuncture, meditation, and different modalities. Again, we're just going to see that trend. I think it's going to be faster and faster now.
So I know for acupuncture, of course, it has to be customized to the individual, but meditation, there's people, I know it would seem that everybody who comes and joins us for these monthly episodes knows about meditation, but honestly, I see the feedback and many don't. So how can a person get started with meditation in a way that will serve them best?
Well, I think one of the best ways that we actually offer a lot of DVDs. There's the cancer, here we go. I don't know if you can see that. This is probably one of the best things to start out with if you don't have access to somebody to take you through a class.
And that's specific to cancer support, right?
This is specific to cancer. This is Qigong and meditation for cancer support.
Okay, gotcha.
So there's a wonderful warm-up exercises, and there's 3 different meditations.
And we offer this on a one-on-one basis for our patients. So when cancer patients come to the office, all 3 offices offer it, and so they can book one-on-one, get coached, and then take the DVD home to practice at home. As well as if they're in the Santa Monica West Side area, they can go down to St. John's every Monday night and join Dr. Frances' class. It's absolutely free.
Complementary parking also.
Right.
Yes, that's one of the things that I love about us is we're always giving back to the community. So if resources don't allow you to do a one-on-one treatment, then there is an opportunity to access something in the community for free as well.
So, so you're talking about the latest and, the advances. I'll tell you, one of the things that's been very exciting in cancer therapy, conventional cancer therapy, is immunotherapy. This is the one area that I think, interestingly, there's a paradigm shift. For a long time, I was talking about 50, 60, 70 years, the way to treat cancer is let's just poison the hell out of cancer.
Yes.
So there's this, there's this kind of a, not such a nice way to say, but when you have cancer, the treatment is slash, burn, and poison. Those are the 3, right? So the slash is surgery, burn is radiation, and poison is chemo, right? And what happened is that while that's all effective to kill the cancer cells, but you could jeopardize and compromise the patient's ability to survive and to heal, and the quality of life just wasn't there. And so for a long time, in the cancer community, there's been this, it's just talk about, hey, let's do something with the immune system, right? I mean, the body should be able to cure this. Well, meanwhile, Chinese medicine, we recognize that, hey, your immune system is where it's at. We got to strengthen, we got to get your body to fight the fight. And how can we support your body to fight the fight? So now, there's advances in immunotherapy, particularly with drugs like, I'll give you an example, Keytruda is one of these drugs. And it's used in like melanoma. So it used to be, you have stage 4 melanoma, you're done. There's no cure for it. The survival rate is virtually nil. And so, but with Keytruda and similar immunotherapy drugs, they're seeing cures. They're actually seeing a number of patients go into remission. And it's because it mobilize your immune system to target specific cancer cells. So that's very exciting. And so we've been seeing a lot of that's going on. But there's still a lot of experiment going on, a lot of trials. They still don't have, immunotherapy for breast cancer or other kind of cancers, right? So it's kind of a laborious process of coming up with something that actually works. In the meantime, we've been helping patients with immune support for many years. And so some of the things that I want to talk about is like thymus, for example. We've been using this thymus. So we formulate these products like this thymus support. And this got, besides various vitamins and so forth, we have like tissue extracts from New Zealand grass-fed happy cows. I know that sounds horrible. I'm sorry about the plant-based people out there, because I'm one of them. But hey, it's kind of like eating kosher. Like, listen, there's exception. If you're kosher and you need medicine, there's an exception, okay?
So it shouldn't be a total loss.
Exactly. But, you've got astragalus, which is one of the major immune-boosting herbs in Chinese medicine, for example. And so we use this. The reason is the thymus gland sits right here, and it atrophies. It begins to atrophy like in your teenage years, and by the time you're 30, it's atrophied. But it's still there. But the main function of thymus is to produce natural killer cells. And these are the cells that target cancer. And so that is one of the reasons why, as you get older, by the time you're 60, this thing is the size of a pea when you were born with the size of a walnut, right? It's gone. And so this is one of the reasons why the risk of cancer goes up, because your troops, your killer cells, are nowhere to be found, or there's very few of them. So this is one of them.
Wait. So, Dr. Mao, is that something everybody should be taking, or how does a person know if they should?
Well, as a preventive, I mean, look, I think I would be, I don't want to say, hey, listen, take this, it'll prevent cancer. All I'm saying is that, listen, there are things out there that can help you improve your immune system, and if your immune system is working better, you have a better chance to defend yourself, right? And that's all I'm saying. Another thing that we have is we have this something called natural immunity. This is a mushroom formula, and we all hear about these medicinal mushrooms. Lots of research, tons of research done here in the U.S., Japan, China, and other places. Mushroom power. I mean, this is very powerful stuff. You have, for example, maitake, reishi, shiitake, these are edible mushrooms, for example, agaricus, and other mushrooms like turkey tail and others, that lion's mane, that have been shown to really be wonderful for supporting your immune system's ability to fight cancer, fight viruses, and so forth. Lots of research. You can just, and again, now this is something I take every day, just because I recognize that these are some of the superfoods that I want in my diet.
I actually have a funny story about that. So today, right as I was getting ready to leave to come over here to the office, I was had the TV on it, and it was the Strahan and Sarah show, which is very popular. It's a segment of Good Morning America, but their afternoon segment. And lo and behold, they were talking about food. They had a nutritionist on, and it was about what is the new superpower food for recipes. And what was it? Mushrooms, of all things. So that goes back exactly to what you're saying.
Absolutely. So again, there are things that you can do. You don't have to wait till you get cancer, God forbid. I mean, we don't want anyone to get cancer. That's why we're sharing a lot of this information through our book. So the book talks about mushrooms and research. We provide lots of evidence-based information. We have the bibliography that goes back to where the studies was done and where was it published, what were the results of the study. So just lots of information, even things on CBD. There's so much rumors about CBD out there for cancer, right? But what is the real answer? What is the deal with it? How can cancer patients use it? And what is the right dosing? I mean, you walk into a store, you're talking to clerks who are basically going to tell you like, oh, well, here, try this. This one is a candy, and this one's a cookie. That's fine and all that, but listen,
it's so not fun. No, I know, but I had somebody
it's fine for if you can't sleep
at a drugstore.
I mean, like if you needed something to sleep, okay, that's okay, but not when you're...
No, but what he says is really true. I never even got to say, I went to this place called Capital Drugs in the Valley, and then Santa Monica Homeopathic, and I had some woman who just decided she was going to be my mentor, who said, take this testosterone, this estrogen, rub it on your arm, 3 times a day, and my God, you're going to feel like $1 million. And I thought, oh, well, $1 million's a lot of bucks, so that sounds like fun. So I did, and it's very well known in the cancer world that I was killing myself by going to some drugstore and talking to somebody named Nobody, and the idiot here was rubbing away thinking, I feel great. No hot flashes. I am perimenopausal. This is amazing. And you know what? My tumor grew 5 times as fast.
Sure.
And I went back there and said, you killed me. You almost killed me. You guys in here, you're peddling stuff that you don't know anything about. One of the reasons that it's so important to get professional help and not just go to a drugstore with someone's just been hired, God bless them, for $14 an hour and is reading on the side, like looking up, well, I can tell you, and then babbling the truth, which isn't the truth. That's another thing that's really important. How to get that in there, because I just remembered that I was given a lot of very bad advice from people who didn't know what they were talking about, and I wanted to make sure that people know that Dr. Mao goes to China every year, and he goes into the forest for months, foraging around, and brings all these herbs back to his clinic and his practice, and bottles them up, and this is what we take, and this is what I drank 5 times a week. Make that 7.
Yeah.
Make that 7 every single day. I mean, every single day.
So
Very
thanks for sharing that.
Yeah.
This was to show that it's true. I mean, this happens all the time. I don't know what that is.
Perhaps not foraging, though. We actually go through a very strict procedure as we're doing our herbs.
So, but that's the thing. The important thing I want to drive home is that we have so much information in this book that is well researched, well documented, and people can read about how they actually can understand how to dose. I mean, again, I go back to like CBD, like people, they're experimenting out there. There's actual protocols that you do. Very importantly, you don't just go out and try to take things on your own. So, I mean, for the most part, I think that if people eat right, sleep well, 8 hours a night, exercise, be happy, get rid of toxic people, and try not to, eat plastics if you can. You'll be fine for the most part, right? But, I think the difficulty is that when you get sick, then what happens? And you do need to get guidance. And we do. We make ourselves available even on Skype. We do telemedicine. So we have people in different parts of the world that we're happy to, review their reports and history and help them create a program for them specifically.
Thank you. I'm going to jump into some of the questions coming in from those that are listening in, if you all don't mind.
Please.
One of the first questions is they'd like more information about nutrition and what type of things are recommended in terms of nutrition, eating habits, and recipes and whatnot. Is that in the book, or is that supplemental information that we can provide for them?
No, that's definitely in the book. There's plenty of information, a whole section about foods that fight cancer, increase the immune system. We break it up into whether they're vegetables, berries, beans, legumes. Definitely you want to really minimize your meat. That is also well documented. A lot of evidence that a meat-centric diet puts you at a higher risk of cancer. So that's one of the first things in terms of prevention, is to really reduce your meat intake. And I'm referring more to red meat, and fish is fine, some chicken is fine, but half your plate really should be all vegetables. We don't get enough servings. The 2 to 3, 4 to 5, you really should be having 10 servings of vegetables, and I'm not exaggerating.
Can you give them some tips on what vegetables to gravitate towards? Because there's so many.
Absolutely. The cruciferous family, which includes Brussels sprouts, cabbage, broccoli, those are all, cauliflower, thank you. Those are probably some of the best cancer-fighting vegetables that you can eat. Of course, all the dark leafy greens. Fruit-wise, I think this month's newsletter, there's the pomegranates, and the berries, blueberries, raspberries, blackberries, all your colors, exactly, all your colors. And then going back to mushrooms, there are food-based mushrooms, maitake and shiitake. Grocery stores, farmers markets, chop them up, saute them with garlic and onions, which are also cancer-fighting foods. Olive oil, that's actually a good source of protein too. So those are some foods you can start with.
Okay.
What else? Ginger. Going back into the herbs, start adding ginger, basil, even the mints, things like that. Goji berries, which is a very, very popular Chinese herb, but also a very important herb to add to your cancer-fighting foods. High in vitamin C, so add your goji berries.
What's your favorite way to use goji berries, Frances?
I actually like to put them in soups. I'll throw maybe a tablespoon when I'm cooking chicken soup. It adds just a little bit of a sweetness there. You can add them to your oatmeal, add them to your smoothies. They're very versatile. So goji berries, easy to eat. I just saw them selling at Costco. Organic goji berries.
There's trail mix and so forth.
Yes.
I eat it as a snack myself.
I eat it as trail mix too. Yeah, I love it that way.
Don't forget, there's a good old-fashioned green tea, right? The most researched, exactly. So there's tea, and actually, it's not just green tea. Black tea is perfectly okay too, and it just depends on what sort of tolerance you have for caffeine. You can also do decaf. Again, don't forget, you can decaf tea yourself by steeping it for 45 seconds. Yeah, and 95% caffeine leaves the leaves. Then you pour that water out, add fresh hot water. Now it's decaf. Have you heard of the Swiss water press, decaffeinated? That's what they do. They take hot water and then they press, through the leaves or the coffee or whatever it is. And
like a French press.
Yeah, it's a water press. So
I do that actually. I do that.
You do?
I do, because when I was in Korea, I bought a press specifically for tea that I had never seen it until I went on a trip to Korea. So you
get rid of caffeine, and the interesting part.
I have an Italian French press too, though.
Yeah, the interesting part is the polyphenol, which is the antioxidant, anti-cancer components. It takes about 3-4 minutes for it to come out of the leaf into the water. And so you need to steep it longer in order to get the benefit. It's the pigment. You gotta make sure the pigment. No, all you have to do is steep it for 45 seconds, and then you just steep it out. Get rid of it and then add fresh hot water. That's all you gotta do.
Done.
Yeah, exactly.
Amen.
Yeah, so there's
really easy to do. Matcha. Matcha's coming up. People want to know, what is this trend with matcha, and is it really beneficial?
It is beneficial, but not in your lattes. If you want pure matcha, you're going to drink it. It's the matcha tea. I would suggest buying the powder, or if there's just the real tea green leaf. So matcha, also plenty of studies done, high in a lot of anti-cancer properties. So you see it because it's trendy in your different coffee shops or in your cookies and in different food products. But you just want to drink the tea alone. It's actually very traditional Japanese tea that they use a brush to stir it up with. So if you are looking for matcha powder, and I have seen it in a lot of different grocery stores too, Sprouts, Whole Foods, that's what you want. Maybe a teaspoon or two. That's very powerful for you.
Okay, thank you. Next question, exercise, to Phyllis. Can you share with us, how did you stay fit during this period? What did you find? I know it's individual to your treatment period, but what did you do for fitness?
Well, I was very encouraged by Dr. Mao to make sure that I continued to do what I usually did. And I'm kind of old-fashioned in the world of lifting weights, a little bit of cardio. I do my own form of yoga. I don't do any Pilates, but I tried to stay on a path where I at least made sure that twice a week I was doing a lot of stretching, keeping my strength, because the last thing I wanted was liquid muscles. And a massage therapist said to me, it was a horrible moment when a massage therapist said to me, "Your muscles feel like liquid to me." And I thought, I better get on this thing right now. So a lot of building, bone marrow was very important, because these poisons, the chemotherapy and the radiation were killing me basically. So I would come for stress management. And so part of my stress management was then to leave and go to the gym and get busy with my weight so that I could go back to chemotherapy. My blood levels would be high and they were willing to give me the chemotherapy again. So there's a circle of, you don't just go for chemotherapy. They have to approve you that week and make sure that your protein levels are high, that your blood count is good. And in order to do that, you have to continue exercising, eating protein. This is part of the whole protocol. I would come down here and he would ask me, "Are you eating your 85 grams a day? That's a lot of protein to get into your body." So we did it with powders, all sorts of different things. "Are you doing your exercises so your bone marrow is strong?" And that became my routine, along with yoga and stretching and standing on my head and trying to do handstands.
I actually want to clarify that, because the diet is different when you're going through chemo.
Right.
Because of the compromise that you're suffering with, as a result of all the, toxic drugs, right? Yeah. So we do emphasize high protein during that time. Now, as a preventative, after all is said and done, and you're ready to, okay, what do I do now to prevent recurrence? Then a plant-based diet, what we've been talking about, is much more, it's advisable, because that's what all the research shows.
Right, but even in my high protein diet, I kept meat very far from I just wasn't interested in it. So
mainly plant-based.
It was plant-based protein,
powder.
plus a little bit like eggs and things like that, just to be comfort food. But my protein was mostly plant-based. And my exercise routine, I think, was more psychological as well as building bone marrow.
Okay.
For my bones. I think it was psychological that I was still a regular human being doing what I would normally do, even though I was also encouraged to sleep a lot. Rest a lot and sleep a lot. He would come in and find me semi-snoring 2 hours later. My treatment.
I love it. That means you're completely relaxed.
Yeah, I said, "No, I'm up. I'm good. How long has it been?" 2 hours.
It's very funny. People come here and they sleep like a baby.
Ooh,
they do.
And acupuncture just kind of really promotes that deep restorative sleep.
But I would also listen to his tapes, and I can't meditate without his voice. So I still do. It's my little passy.
Me too. Imagine he's like my work brother, and I listen to him all day, and then I go home and still listen to him at night.
I know. It's crazy, right? He knows it. He knows it. And it's okay. You can deserve it.
Okay. Thank you for that, Phyllis. Another question, those of you in the audience, if you can please send in your last questions, because we've been on for quite a while, and it's just so gracious of you all to be on here with us. We have many, many thank yous to all three of you, so I want you to be aware that so many complimentary comments are coming in. Thank you for sharing this time with us. The next question is directed to Dr. Mao. What are your thoughts on coffee enemas, Dr. Mao?
Well, it is one of the therapies that have been used for a long time to detoxify. And so, some traditions really promote the use of coffee as a way, through enema, as a way to pull out toxic elements from the bowels. And so it's something that we actually don't do in Chinese medicine. You know, we prefer to give you herbs that will clear out. We use a lot of fiber, also herbs, and we do a detox body work where we do cupping in your abdomen, and then we literally move it around your intestines, like it follow the track of the large intestine in order to kind of cause this stripping of the toxins off the walls of the intestine. So anyway, we do everything possible from this end, you know, in order to kind of excrete out. But certainly I think there is some evidence that the enema therapy can be helpful. But it's just something that we don't provide it, you know, in-house. And so patients would have to go out and find someone reputable and professional who knows what to do with it. But conceptually, I think it's something to think about. There are other things that, you know, people haven't really thought about. Something as simple as heat therapy, as an example, right? So hyperthermia. So you hear about hypothermia, where your body temperature drops to below a certain temperature, and then you have organ damage or extremity damage. But hyperthermia is when you heat the body up to a certain temperature. Interestingly, it's kind of like mimicking a fever. When you have a fever, your immune system's mobilized, and the immune system just attacks at that point. And so there's some evidence, and in fact, NIH has come out with some guidelines about hypothermia, because there's studies that show that when you heat up the body to a certain temperature, the body destroys cancer cells, and that has been shown. So what we do is we use infrared technology to heat up the body in an enclosed environment where the patient heads outside, and we cook the body until they sweat. And so that is an actual a way that we prefer to detoxify, and literally you can measure heavy metals, cholesterol, and all kinds of garbage in the sweat that would not be present when they compared it to regular sauna, just a regular, you know, non-infrared sauna. So anyway, something to think about is another way to detoxify if you don't feel like enema is your thing, which some people feel that way. That's one option.
Okay, thank you. Last question I'm going to take from here, and then I think we've answered everybody with their immediate questions. But again, if you have other questions you'd like to email to us, you can send those to marketing@infinici.com, and I will pass them over to our three participants, depending on who you'd like the answer from. Legacy. Let's talk about legacy, the emotional side of it, and each of you brings to tonight's episode a different perspective. And I don't know who this question was directed to. So maybe Phyllis, if you could start and just talk about, I imagine this individual is probably asking, did you think about legacy, like what you wanted to pass on as you were going through your emotional journey in this process? Oh no, we lost them. I apologize, everyone. We have, I think because Zoom is on a timer, we ran out. We hit our limit on that. So I do apologize that I'm not going to have an answer for you regarding that. But I will see if I can get something, and we will include that in writing. I just want to let you all know before we go tonight, I know this was a very long episode, but I do hope that those of you that have tuned in tonight will pass this on to share with friends and family, because there was a lot of information here tonight that was quite exceptional. And, you know, as we pointed out from the onset, it isn't just about the cancer treatment journey, but it's things that you can do preventative-wise in your daily lifestyle. And it's so important that we reflect on this as those of us that are attending the event, but then we pass that forward and share that out with others so that they can look at things perhaps from a different perspective too. So this episode is available immediately when I end now, and it is on Facebook in the videos section of the Tao of Wellness Facebook page. You just go to the videos and you can click on that. And then for those of you that are on Zoom, we will have this available as of Saturday. I will load up a replay of this. Oh, I think we got them back. Hold on one moment. Let me see if I can switch them over. Yeah, we did get them back. Okay, so those of you that are on Zoom, it will be available in replay through YouTube when you're ready. Hello, everyone. I don't know if I can get you back on sound again. Can you hear me?
Sound?
Yep, there we go. You've got sound again.
Woo!
Okay, all right.
We're so smart.
We're
not.
sorry. I was hoping this wouldn't happen, but we ran out of battery.
Oh, I thought the opposite. I thought Zoom said, "Oh, you all have been on too long. We're kicking you out."
No. We're in the middle of something and we want to say we're back.
All right. Well,
Okay, well, I'm going to let each of you say goodbye. We did have a couple of additional questions, but I will email those over and we'll get answers to the individuals. But this time is for you. What would you like to share as your final thoughts for tonight?
You're the hero. You should go first.
No, you go first.
Oh, well, I just wanted to say thank you so much for your very kind and thoughtful questions, and to say thank you for inviting me. It was fun to be here. I don't know if fun's the right word, but I hope I can help anybody that needs help. And anybody who wants to get in touch with me, feel free. I really am an open book, and I'm more than willing to help anybody. And I also tell people, don't if you don't want to, because people are afraid a little bit. But so thank you so much for your loveliness.
Oh, for us, it's a pleasure to have you with us, Phyllis. I have a feeling you're going to be returning to us soon because
Yes, you're awesome.
Whatever you
yes, so I say on behalf of the audience, thank you, because
really.
it's not really from me. It's on behalf of the audience, and I know that they're very appreciative of you being here tonight.
Whatever anybody needs, I love to help.
It's
a big deal to stay alive.
And you're doing it magnificently.
That's good.
All right, so thank you, Tiffany. Thank you for the audience listening in. I hope we provided a lot of information for you to move forward, whether you are have cancer currently, or a survivor, or know of anybody. Please also, we are open to questions and things like that. Feel free to always contact us, and we can point you in the right direction, provide you with a lot of our own support too. So thank you again for everything.
Oh, thank you, Frances. And Dr. Mao?
Well, listen, I mean, it's such an honor to, be in the presence of, Phyllis, who's been such an inspiration to me personally and to so many people. So thank you, Phyllis, for coming on. And I'm just hopeful that, again, we just want to share this information. Really, the whole premise is, with information, you have power to make choices, and that choice can translate into the difference of a life well lived, and that's what we're all after. So anyway, I hope that we've done a little bit of that tonight, and anyway, this has been fun. We're gonna have to do this more often.
Oh yeah,
yes.
We're in.
Next time we'll
knock
get some
on that
tea,
door.
and we can have some tea. Yeah.
Ooh,
Okay.
we'll eat some food too.
Exactly. Yeah.
Okay.
Okay. All right.
Thank you all so much again. And to our audience, thank you for staying on with us this evening. Again, we will get back to you on the questions we didn't answer. I will get you the responses and we'll pop that over to you. So please feel free to keep adding comments if you have questions. Oh, you're getting thank yous and much blessings to the three of you. So let's end it here on a beautiful note. Good night, everyone. And please tune in for the month of May as we have a whole new series of topics for you.
Peace and love.
Bye.
Bye. Much love. Bye.
Bye.